So first of all, thank you so much for coming here and gracing us with your presence.
My pleasure.
Yes. So I love English etymological and in all languages etymology, which is the origin of a word, of how a word came into being. And one word that I was reading about is called portmanteau. It's a French word which means a suitcase with double compartments.
Right.
And then portmanteau was also used a lot by Lewis Carroll, the author of Alice in Wonderland.
Yes.
So that is now being used in literature as a word where two words are mixed together.
Right.
So like a bedroom. Or better word now in radiology is radiopreneurship.
Yes.
Radiopreneurship is a portmanteau, and you are a living example of that portmanteau. So I want you to define what this radiopreneurship means.
See, basically, radiology is a glorified, MD that was, everybody was keen to take on.
Right.
But then what doctors don't understand is that there is a ceiling. Your entry is at a very high level, but then after some time, then it gets saturated both in economically as well as the growth in your the subject as well.
Yes.
So that's when we feel that there should be another avenue for growth, and that is how radio entrepreneurship came in, and we clubbed it into and we started doing a lot of things outside radiology or things connected with radiology but with business as well.
Right. Now tell me about your journey from being a radiologist to becoming a radiopreneurship. How did that go about?
It was by accident, not that I planned that I should do this at this point. So I was happily working in a very big corporate hospital for almost 10 years. And then, of course, I got inspired by two great people, Professor Amarnath and Dr. Hemant Patel.
Right.
So both of them were doing both together. So, and then Dr. Amarnath said, why don't you get into the business part of radiology as well? And that's how I got into it.
Lovely. Now, I always feel that when a sculpture gets made, you keep adding mud to it, and then you shape it. Similarly, a person is like that. You keep adding values, traits, characteristics. So at a young age, I'm very sure you might be enterprising, you might be resourceful. So knowingly or unknowingly, at a young, early age, what were the skills that you developed which has helped you become the person, a radiopreneur that you are today?
So, there's nothing fixed, but then you have to keep your eyes open. And, leadership is always something, it's a characteristic trait that somebody develops. So I was, from school, being that, and I was the student chairman in school, then the college chairman. And so I always had that leadership skill. But then business is something that, is something that you get enticed with. And when this leadership meets that business opportunity, that is when it kicks off. And everybody, I think, should read a lot. I think that is where the key is. And at one point you should stop reading fiction and at young age itself, and then start reading, which will really, I think, will be the key to your growth in leadership.
Very interesting. Very interesting. Now, sir, you have also done an MBA.
Yes.
So, what were the skills from the MBA that were the most helpful, especially for a radiologist and for the business of radiology that you learned? And not everybody will have the time to go and pursue an MBA formally. It's a luxury as well. So, what are the things that you took away mainly from your MBA, especially for a radiology business?
See, so once you are into medicine, from 11th standard you are away with maths.
Right.
So you will never think about maths and commerce and economics. We're very scared about those subjects. So, but once you are into your business, that's when you realize that how important it is to understand the math of the business, to understand the commerce, so that is why MBA plays a very keen role. So, most of these, even the health MBAs, usually start off. The first year is common to all MBAs. So they teach you maths, statistics, economics, commerce, and then you specialize into the branch that you are doing. So that is very important for anybody who is thinking of entrepreneurship. And so, you don't have to do a formal MBA as well.
Right.
If you have the time, it's good. But if you don't, then there are so many things available at open source, which can actually teach you all these.
Right.
But you should take that effort, an hour or so every day, to understand the how business works,
Right.
and how entrepreneurship works, and because we never understand the business of radiology.
Right.
So, for example, we think that, for example, fetal ultrasound.
Right.
We just think it's for a radiologist, it's 2,000 rupees per scan.
Correct.
But then there are 12,000 pregnancies happening in a city, or
Right.
says, and she does 3 scans a day, three scans in a pregnancy,
Right.
which means we are looking at about 1 crore of business in that one small city. So the entire India, it is a 12,000 crore business, only fetal ultrasound.
Yes.
So that math, when we understand,
Right.
then we see the bigger picture, then we see the scope
Right.
of business in what we do.
Absolutely. So it's all about numbers. It's all about the metrics.
Yes.
Right. Sir. So now I want, there will be a lot of young radiologists watching this, and young radiologists who want to start their own radiology center.
Yes.
Be it ultrasound center, be it an MRI or CT scan center, or a higher modality center.
Yes.
Give me a basic, like if they want to start today, what is a simple guideline that they can follow? I know it's not simple, but something that they should keep in mind which can help them a lot.
I mean, the first thing I will say is, if you think that you should start a center, do it.
Right.
So, there will be so many people discouraging,
Right.
and so many people saying, what if, but then if you put your heart and soul to it, it will click. And a radiology owned center is the best thing. So if for a small starting entrepreneur, the first center he is going to do, my only advice is that you sit in your center morning to evening. Your center will do well.
Amazing. I think that is the best.
That is the
ever.
best thing.
Yeah.
So you once you grow, of course, you can't be everywhere. You can hire radiologists,
Yeah.
but when you start off, be there from morning to evening. You can never fail.
Super. So it's complete, utter devotion.
Divorce.
Temple.
Exactly. So
Super.
because a radiology owned center, so the patient comes, you care, it is your patient, so you care, and then you talk to the referring consultant, you
Right.
discuss with him. So then the confidence builds, and
Right.
then that doctor will not send the patient to anybody else.
Okay.
So it might take 6 months to 1 year, but then a radiology owned center never fails.
Right, sir. So now the most important thing that you have also mentioned about, not the most important, but a very important thing about radiological practice, especially private practice, is referring consultants and
Yes.
clinician friends. So a young radiologist who does not have any connection in the industry, how can they go about making a reputation with these clinicians? And what is one key factor that they should develop in themselves to become a good friend of the referring doctor?
See, 2 important things. One, of course, is the quality of the scan that we do, and the machine that you have. So if you have a good machine and if you have a good report, then the clinician starts respecting you. And then the second important thing is, whenever a clinician refers the patient to you, that he has a question, and you should ensure that you answer that question.
Okay.
So in your report, as well as if it is complex, don't hesitate to pick up that phone and call your fellow
Yeah.
colleague and tell him that, boss, you sent me for this, I'm seeing this, could it be this? So I think, and you build a consensus around your report,
Yeah.
so that the clinician is also happy, because he's sending the
Yeah.
patient for something else. You just write a few lines and send it back, and he still doesn't know what to do.
Right.
So once you build that rapport, the clinician will be so dedicated to it.
So to sum it up, it would be like, clinicians are thirsty for the answer. You have to figure out what the thirst is and satisfy them.
exactly.
Okay.
And you don't feed something else.
Right. And now, sir, I want to get into something that is very interesting that I find about you, and something that I also learned right now, that since your schooling, you have been a chairperson of the house, and even in your college days you are that, and even in radiology, in IRIA, you have been leading so many institutions and so many societies. Even right now, I think you are the president of the Tamil Nadu state chapter, and of course, you are a president-elect of IRIA. So it's an absolute honor having you here. And you have also led the Yuva wing, especially for young radiologists. So, sir, how do you build these organizations? How do you lead them? And and how does one get into them?
See, basically, organizations are in a huge demand for young talent. And so when I joined the Tamil Nadu Radiology Association, Dr. Jairaj, who was already the secretary there, and I was working in his department, and he said, only why don't you give me a hand? I'm finding it very difficult to handle it. And that's how it started.
Correct.
But then we have to, once you are dedicated to your association, then you yourself will understand the need of the association and the need of its members.
Right.
So, Dr. Hemant, when he was the president, he said that, we keep teaching, we keep interacting with all these senior people, but we never touch these young students who actually have a lot of hope and, joining the association. So what are we doing for them? Then we both traveled to the European College one day, and then we saw this, the youth, they were giving a lot of importance to the students and giving a lot of fellowships and a lot of training. And that's when he said, we should do this in India. And he said, Murali, why don't you lead this? And that's how the Yuva wing or the youth wing of the IRA came up. And then it became hugely popular. So many youngsters, got connected to it. And, so not only academics, we got into cultural, sports, and whatever, the youngsters, feel at that time.
Right.
So that's how, we have to identify the need, identify the talent, and bring these together.
And if I'm not...
And it's a long process.
Right, sir. And if I'm not mistaken, you are the youngest president-elect of IRIA.
Yes.
And you are sort of a cult figure for young radiologists. It is true. I mean, I've been, traveling all around the venue here at IRIA 2026. And if you want to find Murali, sir, you just find the group of youth somewhere, and you know that he's in the middle of the group nurturing these young radiologists. So, sir, what is one trait that you look for young radiologists who want to become a leader, and something that people as young radiologists who want to become a leader and pursue that path inculcate in themselves?
See, most of the time what happens is that a lot of people have interest, but then they get lost in the way because of lack of time.
Right.
So I think that is very key to balance your profession and your association.
Right.
And because you will be losing a lot of time, and you have to give a lot of time to the association. Most of your weekends are gone. So I mean, you have to build your your family, your business, and your association around you, so that you're able to give time to all of them. So because what happened nowadays, especially for the youngsters, is that what do I get out of it?
Yes. Exactly.
Why should I get into this?
Yes.
And but there is a lot the association can also give you. It gives you that recognition. It gives you that platform to go international, and the association itself needs people, young people, to fortify it. So I think.
Absolutely, sir. I was going to ask you that questions, that even as a young person myself, I would always question, if I join your society or your organization, and pursue a leadership path, give all of my time, energy, what do I get out of it? And as you said, I think it is those intangible things,
Yes.
It makes the person that you are. It makes you the person that you end up being. And, my father always used to quote this line from Amitabh Bachchan, or someone, I think, "Main chalta gaya, karwa banta gaya." So it's, I think it's something like that.
I'm a big example in the sense that nobody would have dreamt that a 27,000 association will have a 42-year-old president, because we always had seniors to guide us, and there's still a lot of seniors who are yet to take into that position. But then they understand the time and the work that we do for the association, and they're ready to let us be. Yes.
But I think it is really marvelous, and I think it shows the maturity of IRIA as an association, that they are secure enough to choose someone so young as you. And I think, and have that trust in the youth. And I think that is what I think other associations and other fraternities can learn as well from IRIA. So that is really amazing. Coming back to the business point of it all, sir, radiology, technology heavy field. And it is very, very fast evolving, especially the advent of AI has completely changed the game. It has catalyzed the growth as well. So 5 years down the line, 10 years down the line, what do you think? What are you expecting from the field to come?
See, radiology is as the most dynamically evolving field, as you said, and if to quote Sundar Pichai, he said radiology will be the first medical field that AI will most likely take over as soon as possible. But then behind every machine there has to be a man. When computers were invented, they said that all of us will lose a job. There'll be no more clerks, and but there would be no more clerks. But then there'll be some other profession. So we have so many IT people here doing so much software development. Same thing with radiology. So I mean, the radiologists will have to evolve themselves. Of course, AI will reduce the work burden, and but then we have to find new resources and growth paths and new business ventures, because I think radiology is also going to open up so much other AI is going to help us open up so many other new ventures, and we're going to have the time for it now. So we're not going to run off the mill things. We're not going to keep reporting normal x-rays, normal CTs. Of course, that's going to be taken off our plate, but then we are going to have so many other new things. We can do more research, we can do more complex things, complex works, interventions, and ultrasound interventions. So that, I think the youngsters nowadays have actually understood that. And they're going towards
yes,
that,
and sir, I feel AI is the early adapter of radiology is the early adapter of the big AI, and I think radiologists can become the trailblazers for rest of the medicine and medical community to integrate AI into the workflows and patient treatment and management. So I think you guys can sort of teach everybody else to lead the way with a good balance of human touch and the machine efficiency.
Absolutely. Because even now, if you see the diagnosis of a patient, which used to be in the clinical room, has moved towards the radiology console.
Correct.
Because the scan is done and the consultant comes, discusses, and then takes the next step forward. So I think even the integration of AI somehow, I think even in a corporate hospital, is going to start from the radiology department and go up into every part of the hospital.
Right. Sir, Achilles from Greek mythology, the most invincible warrior, like Krishna Bhagavan also. But there was this chink in his armor, the Achilles heel, where, the only weak spot. And although radiology is similar to Achilles in that way, that it seems like such a lovely branch, dynamic, first in everything. But sir, what are some pitfalls that you see, some places where radiology as a whole can still improve?
Okay. I think we have become now more better than what we were initially. The only problem was the connect with the doctors and the connect with the patients. So that was something that we never had before, and now that is why we evolving ourselves. We don't call anymore. We are not called anymore photographers, and radiology is becoming clinical radiology. So that is when when we have the direct connect with the patient, when we have our own OPDs, when we have our own intervention suits. That is how initially radiology we were very hesitant. We were very darkroom people. We were sitting in one corners, but now we have to come out and grow as clinicians. And remember, radiology is also a clinical branch and not a non-clinical branch. I think that is where the future is for it.
Correct. Lovely answer. Also, sir, we as Indians, and especially us as doctors, we are always very tight-lipped about the money part, about the financial part, and business, money, finance, salary. All of these are taboo words for us to use. But sir, it is still very necessary and relevant to the sustenance of a family, of your own self, of your own career. So what is one financial advice that you might have for young trainees, young radiologists, something that they should implement from a young age for financial prosperity throughout their career?
See, two things. One is that initially when you start off, immediately post your MD or your DNB or something, there are places which offer you a lot of salary, but then you'll be alone by yourself. Maybe in a peripheral center or a small remote place. But you'll be the king of that place, but you'll be paid 3 times of what the city or a corporate hospital pays you. Don't get fancied by that, because your training is just got over. So always work at least in the first 3 to 4 years of your career in a place. Your salary might be 10,000, 20,000, 1 lakh less, but that's when you get your guidance, and that is when you're building your career. And for the 2 or 3 or 4 years that you do, work under somebody, build a rapport, find your specialty, and then you can branch out, and then that is where maybe 5-6 years is a good time when then you decide whether you want to do your own center, whether you want to work in a corporate hospital, whether you want to go to a peripheral place and build your own thing. As far as the finances is concerned, young people, I think, take it. Don't worry, radiology is quite secure that way. you will be able to make your family be comfortable. But then slowly build, put money in different baskets is what I say. Almost 30% of whatever you earn, you try to save. And that saving has to be in different baskets.
Yeah.
Have a policy for yourself, a health insurance policy, put something in the stock market, put something in gold. But we have a big basket. I mean, I'm not a financial guy, but that's how I do. I'm not very trained, but even if one bombs the other, something else is going to save.
Diversification.
Diversification is something that is going to help.
Right.
And build a habit of saving. That's what I say.
Amazing.
Yeah, and the principle of compounding. So just keep investing small amounts, and then you will, before you realize, you have a big sum.
Yeah. Sir, a conversation with you is always so rife with such relevant information. Of course, you are a great clinician, and but at the same time, we had you today here for the entrepreneurship part. And I want to keep talking to you, but I know that you have a very busy schedule at IRIA. Hopefully, we can catch hold of you on RadNexa platform, where we can have a proper radio lecture series of completely on entrepreneurship and even on onco imaging, which is one of your main focuses in clinical practice as well. So now I just want to have a fun rapid fire round with you.
Sure.
Okay. Entrepreneurship in radiology in one word.
It's a must.
It's a must. One skill every radiologist should develop to become future ready.
Future?
Ready.
Connect with the clinicians.
Correct. One mistake that kills growth early in a career.
To start working independently very early.
Yeah.
Yeah.
2 to 4 books, fiction, non-fiction, any of your choice, that you recommend to everybody.
Okay. The Power of Compounding. That's one book. The business side. Okay, I'm Akigai. If you,
yes.
That's one of my favorite books. And of course, read the clinical radiology.
That is a great advice. And in the end, one piece of advice you'd give a resident who wants to become a radiopreneur.
It's very good that you're thinking about entrepreneurship during your residency. The way to go, read and plan for it. Yeah.
Superb. Yeah. Thank you so much once again, sir. And we really appreciate you spending your time with us. And hopefully all of us, we get to see you on RadNexa and in person as well. And keep inspiring us youngins and to pursue better, to be better. So thank you so much once again.
Thank you. My pleasure. Thank you.
Thank you.
All the best.